Dr. Buck, I know after patients have had their procedure done and they come in post-operatively, after most of the swelling has gone down and they see maybe on their second visit, some patients might have some problem with some excess skin or a little laxity in the area, and they're concerned about that. We touched upon it talking about how the Cool Touch laser could internally tighten some of the areas like the chin and the back of the arms. But for most of our patients, if they have some laxity of their skin they don't like, what would you tell them that they should do?
Well, fortunately, as you know, Kathy, we've been looking for about a year to try to find something that will work on the thicker skin. Mm-hmm. And as in my past history, I used to remove a lot of redundant skin on individuals that had been morbidly obese. They'd lost the weight. They needed to get rid of the skin. But we still have that same problem with let's say, a woman that gained quite a bit of weight during pregnancy, mm-hmm. for instance, and they were a rather petite woman. Well, they have stretched their skin out to the point that there's just no way that it's going to have enough collagen activity and all to contract that back down. And like I said, we searched and searched, and we finally stumbled on something that I think works very well for that. And it doesn't matter about the thickness of the skin. And it's called the Accent, and it's a radio frequency machine that actually will contract that skin down to a favorable amount. Whereas with some women, whenever I would go in and, let's say, for instance, rather not just abdomens, but say do inner thighs, mm-hmm. women don't like droopy skin after they've had that removed. They want that skin to be as firm and tight as it can possibly be made. And that's what this machine affords us. And not only will it do that, it will actually have some effect on the cellulite that they have, the residual cellulite that they might have. It has some effect on any unevenness of the skin. So it really is, it's about the only thing we've been able to find that was successful other than actually cutting the skin out. Well, you pretty much defeat the purpose of doing the liposuction if you're going to have big scars afterwards to take the skin out. Sure. So this is a great thing to have, and we have it available in this office.
Well, I know we looked at a lot of different machines, looking at claims made on them, and then we decided on the Accent because it had both the unipolar and the bipolar radio frequency that we could work on skin on the face and neck for wrinkles and sagging, because it went both very deep into the skin. You can go to get the fat tissue compressed. You can go to work on the cellulite, which is more superficial in the skin, and also the superficial, the light skin on the face and the neck. So many women and men complain of the drooping necks and the jowls, that we can work on all those areas and actually compress the fat and change the architecture of the skin by doing that, correct?
And that's one of the few machines that will do that, because there's no way that you can do liposuction above the jawbone because of the facial nerve that's there. But with this machine, you can actually go up into the jowls and cheeks and try to get some of the adipose tissue removed from that and tighten the skin.
That's great. And when do you say, when somebody wants tightening, Dr. Buck, how far out from surgery do you usually generally wait?
They don't like it, but I recommend that they wait probably about 6 months. And the reason is, the less that you have to tighten, the more success you're going to have, no matter what type of apparatus that you use to do it. And if you can assure that individual after 4 to 6 months that if it is not tightened up by that time, it's not going to tighten.
Because the compression garment is going to tighten it during that time, and the skin has to compartmentalize after all the tumescent fluid and everything, and it'll break down and it'll tighten up, and then once it hits that mark, 4 to 6 months, is when they would say, oh, well, maybe I need some additional tightening.
That's correct, and I really don't hesitate to recommend this Accent, because, like we've already expounded on, we've searched everywhere trying to find the right machine to do the right thing, and then we've located that. So.
Yeah, it's a wonderful technology. Well, thank you.
Thank you.